Okay. It's my great pleasure to be here with you. Welcome, everybody. We will start the 5th webinar of International Society of Health Education about guidelines of vaccination, COVID-19, and possible long-term side effects. May I ask Dr. Salman Al-Rawaf, Chairman of the Society, to start the webinar with lecture about guidelines of vaccination, COVID-19, and possible long-term side effects. Okay, please, you can start, Dr. Salman.
Thank you very much, Professor Maytham, and welcome everyone. Good morning, good afternoon, good evening, and happy 2021. A year we hope that it will be peaceful for everyone in the world, as well as it will be a year free of COVID and any associated complication. The issues of the vaccine is a fantastic and welcome development. It is really an achievement of science. We really have to congratulate the biomedical sciences about this fantastic achievement. It's a record time in having the vaccine. Of course, any new vaccine require a new guideline, although all vaccines now, 3 of them are approved in different parts of the world. And the 3 are actually in use. So there we have some interim approval of the 3 vaccine, as well as we have interim guidelines. So hopefully today, we will know a little bit more about this and how should we use it.
No. I'm on a webinar, the International Society. No, I'm not present.
Okay. Yeah. Yes.
Up to you, Maytham.
Yes, Dr. Salman. Okay, you can start. Yes, Dr. Salman.
Yeah, carry on.
Yes. Okay.
Carry on. Shall we start with the first lecture?
Yes, you can.
All right. Okay. Let us fit the first lecture. Let me load it first. I hope you can see the full screen. I think all of us now familiar about what is available in the market and what is the interim approval of the 3 vaccine given. We have a German vaccine, which is adopted by Pfizer, and we have an American vaccine from Boston by Moderna. Again, today was approved across Europe. And of course, we have the AstraZeneca Oxford vaccine, which is approved in United Kingdom. You will see the stages in a second or two. I think one of the most important things about this vaccine, as I said in my introduction, this is a great development, it's a great achievement of science. Although people are putting a lot of doubt, there are a lot of conspiracy theories about the vaccine. By the way, all these are not justified and not acceptable, simply because the vaccines which we have, for example, the Pfizer vaccine, is a new technology. There are about 8 new technologies invented for this vaccine, about 100 vaccines around the world. We will see more approved in due course. But let us take some of these. The Pfizer vaccine, or the BioNTech, the German company, actually they were working on this vaccine for many years, not for COVID. This vaccine, which is the messenger RNA, was designed and a new innovation to vaccinate against cancer cells, but they captured the opportunity very quickly early last year when COVID-19 was actually declared as a pandemic around the world. and indeed they modify it to address the genome of the COVID and creating immunity, both cellular as well as fluid immunity, to prevent the infection. And that is absolutely great development. Likewise, with AstraZeneca vaccine, this technology actually, Oxford are working on it since 2014, since the issues of Ebola, and they were trying to find a new vaccine for infectious diseases around the world. And they, exactly in the same way like Pfizer did, capture the market opportunity and decided, that they have something ready, let us try it and use it very quickly for the current pandemic. And indeed proved to be very successful. So all this element of doubt and conspiracy theories, we must put it aside. These are really strong vaccines based on science. I'm trying to cover these quickly, these points, the 3 vaccine, which by the way, they have emergency use approval. So they don't have a final, none of these vaccines have a final approval, i.e. approved to be 100% or whatever X% safe and efficient. None of these pass that stage. All are used under emergency approval. I'll touch on the logistic guidelines because especially with those which require ice cold chain or cold chain, actually they have to have specific logistic guideline. The vaccine application is different from one vaccine to another. The discussion about a single dose, whether we should have as recommended for 2 doses, or the discussion which is raised by the 4 chief medical officers in the United Kingdom that 1 dose at the present time will be suffice. And then what are the target priority population for which the vaccine will be used? I don't need to remind everyone, these are the 8 technologies which is discovered and used this year. As I said, these are fantastic development. So far, we have the messenger RNA vaccine, which is both Pfizer and Moderna. And we have the viral carrier or viral vector called, which is the Oxford AstraZeneca vaccine. So let us focus on these 3. I know in some countries, especially in the Arab world, we have in the UAE, already they started to use the Chinese vaccine, which is actually, it's a dead virus vaccine. But unfortunately, the inactivated virus, we don't have much information about it at all. Similar things about the Russian, which is a viral vector similar to the AstraZeneca technology. They just started in Hungary, in Budapest, a clinical trial, the 3rd phase, but we don't have much information apart from the 1 article published in the Lancet about phase 2. So let us focus on the 3 vaccine, and I apologize if people feel that we should really cover much wider area. Maybe we expand once we know that additional vaccine will be approved. Again, these are the front runner as published by WHO, and you can have the update on their website. I thought just to summarize how this vaccine works, there are certain type, none of these actually exist now, i.e. licensed, but these two are licensed, the RNA and the protein vaccines. The protein one, which is the vector carrier, etc., is a very short circle, is that generating stimulate fluid and cell immunity very quickly, while the RNA causing variety of things, it may take a little bit longer time, and I'll touch on these in a minute or two. Okay, let us look at the logistic guideline and the called chain supply, etc. As you know, the three vaccines which are approved now, two of these, the Pfizer and Moderna, which I said approved today across Europe, actually required cold chain. And that really a nightmare for many countries around the world. I know in the United Kingdom, for example, the government, when data were published about the Pfizer BioNTech vaccine, they invested about 150 million. And this is a huge amount of money to ensure that some of the key hospitals across the UK, 4 countries, actually they have the facilities for -70 storage of the vaccine. And it is a very complex process, by the way. I don't want to go through all this, you know, but even we don't have yet airplanes that can carry things under -70 or -80 to take it around the world. And if you think about 8 billion people around the world, if we exclude pregnant women, lactating women, children under the age, or adolescent and children under the age of 20, say this is 50% of the population, how you will be able to deliver about 8 billion doses multiplied by 2, sorry, 4 billion doses multiplied by 2, this is 8 billion doses of these 3 vaccines. So I want you to think about this is not an easy. Also, the cost of it is very high. Each dose of Pfizer, for example, is about $20. By the time you will add the cost of the trained people, the cold chain, this may go up to 60 in some countries to about $100. So that per dose, that a huge amount of money for some countries. So we need to take that into account. We don't have accurate figure, but early estimate from colleagues around the world hesitant to use these 2 vaccines mainly for the cost reason. And I wouldn't blame them. Let us look at the use of vaccine. It's not straightforward as a lot of people may think. The doses available for the 3 vaccines, the Pfizer, BioNTech, and Moderna. Moderna and AstraZeneca used almost similar doses, while BioNTech slightly different doses. Although the technology in BioNTech and Moderna are exactly the same or similar, but they are not interchangeable. The guideline specifically said, especially from the CDC Atlanta, specifically identify this point and said, look, this is not interchangeable, not simply because I received the first dose from Pfizer, I'm going to use the second dose. Although some scientists, they said there is absolutely no harm, even could be interchangeable with AstraZeneca, but I doubt it. We don't have much data. We need to be extremely careful. And these are long list of things which should and should not do. All these vaccines should not be given with other vaccine. For example, if you want to give for the elderly people over the age of 60 flu vaccine, you should not combine the 2. There is no booster dose needed beyond the 2 doses, which are actually prescribed by the manufacturer. symptomatic or asymptomatic patient can receive the vaccine, as far as they are not ill. If they are ill and diagnosed as people, they go to the COVID-19, they should be deferred until full recovery. It's very important they specify that. No prior antibody tests needed, because a lot of people saying, look, I'm infected every day. I mean, I appear on television, radio, and people asking this question, saying, look, I'm infected. Should I use the vaccine? We said yes, but maybe you put yourself toward the least priority. Allow the people who are on the top of priority list, and perhaps at the end, people with infection, proved infection, and IgG test should really delayed toward the end rather than on the priority list. Those who actually vaccinated and developed C19, there is no harm for them in receiving the full course of treatment, all type treatment. So far, there are a few cases from the clinical trial who received the vaccine, but yet they got infection, they received treatment, and they recovered. There are, as you know, very few mortality. Actually, those know for persons with monoclonal or plasma treatment. I mean, those who receive monoclonal antibodies or antibodies through plasma should not be vaccinated. That came very clear in the guideline. There will be no benefit for those who are exposed and definitely exposed to the vaccine until they finish their quarantine. And you see that actually to have all this within the system and people are fully aware of all these things, provided that the people telling us the truth, are quite complex, because we have to deal with it in this way. Those with the underlying condition, they are recommended to receive the vaccine, and they will benefit from the vaccine, whether you have a heart disease or you have cancer or you have type 1 diabetes, you could benefit easily from the vaccine. Immunocompromised person or those with HIV, we don't have any data. Well, I believe there's absolutely no harm from them to receive the vaccine, because there are a lot of harm in getting the disease, but no data, we don't have data. Similarly for the autoimmune, although some of the literature saying if there is no contraindication, and there is a list of contraindication, then they could benefit from vaccination. Bell palsy, we need to remember that one of the side effects of these vaccines, in a very, very small number of cases, is Bell palsy. But certainly Bell palsy, Guillain-Barré syndrome, although there is no data, but actually side effect is as I said, Bell palsy is a side effect in the Pfizer vaccine, but it's really worth considering that these type of patients may benefit from the vaccine. I don't know why we jumped to the contraindication. Yes, okay. Yes. Let me look at the contraindication, and there is a long list of, let me look at this one first. The most important contraindication is the issues of allergy, because we know that with Pfizer, especially with Pfizer vaccine, we have to wait and put the patient who receive, or the individual who receive the vaccine should wait for at least 15 minutes, because we don't know, what type of reaction they may get, even apparently minor allergic reaction may cause that sort of effect. So the immediate allergic reaction of any severity to previous dose, of vaccine or any component, including polythene. So all these are contraindicated. It should not be used. All the three vaccines are not licensed for pregnant, lactating women, and for children and adolescents under the age of 20. Despite the fact the new variant, this is really a major public health problem. The new variant of the virus, we have two new variants circulating around the world. One originated in England, and the second one in South Africa, are mainly affecting young people. And the clinician will tell you that a good number of these around the world now in hospitals are in much lower age group than in the first wave. And if we look at the precaution, there are a lot of the list of precaution which people who are trained, that's why we say this vaccine should not be given by anyone. People need to be trained to give the vaccine, and therefore they expose them to all these, and they should be aware and they should ask the questions. They should take time in looking in the history of the individual to whom they are giving the vaccine. And this is really very important. It should be, I don't want to spend a lot of time on it. But it is extremely important that we take full history and we discuss with the individual who will receive the vaccine all these points. Side effects, there are the very common side effects are actually similar to the disease itself and similar to common cold and flu. You feel tenderness, pain, redness, itching, swelling, unwell, tired, headache, fever, etc. And this goes on, common, but affecting less than 1 in 10 people, feeling sick, flu-like symptoms, as I said, running nose, etc. But the most uncommon, feeling dizzy, decreased appetite, abdominal pain. Few people I know reported abdominal pain following the vaccine. A large lymph node and excessive sweating, itchy skin, and rash. Actually, even with the COVID itself, even mild symptoms, some of these are actually reported. Okay, observation after the vaccine, I mean, people see it as disadvantage. For example, the Pfizer, we don't have experience much with Moderna. This is Margaret, the first woman who received the Pfizer vaccine in the world, and it happened to be in the United Kingdom. And she's in her 80s. And actually, she has to wait for 15 minutes. And every person who will receive the Pfizer BioNTech vaccine must wait for 15 minutes before we have the second person. That is not the case with the AstraZeneca. So in terms of the logistic, because AstraZeneca you can give by the same vaccinator, by the same person, much more doses to many people. And again, that one of the advantage, in addition to, most importantly, that the AstraZeneca doesn't need cold chain. You can actually put it in the fridge, ordinary fridge, or even room temperature. The priority groups, which has been identified by various committees around the world, and even WHO, suggested similar line that especially across Europe and Western world, where we have a high percentage of the population are in advanced age groups. So residential home, whether it's nursing home or care of the elderly homes, they should be given a priority. It was very difficult actually to administer Pfizer vaccine in nursing home, but that much easier for AstraZeneca because most of the Pfizer vaccine in the UK, for example, from our experience, were delivered in hospitals or location which is managed by hospital. And you need to consider that having these settings and people are trained mainly from hospitals so far, hopefully we will have volunteers very soon. It's really creating a huge opportunity cost, i.e. you are taking a lot of people away from their expected daily work to do something totally different. Yes, it is important, it's pandemic, but we need to take that into account. Our health system in the UK is ready because we have one integrated health system, which is called the NHS. In other countries, that is certainly not the case. And for the AstraZeneca vaccine, they are starting from now to be delivered next Monday in primary care setting, because what is required for that vaccine in terms of logistic is by far much more simpler and easier. So these are the age groups and the priority groups which will receive the vaccine. I just want to show this couple of slides that actually to achieve the herd immunity, we need to cover almost about, because children are excluded and pregnant women are excluded, we need to achieve, roughly speaking, about 80 to 85% of the target population, the population I just mentioned in the previous slide. And that is really quite challenging, between 60 to 85. Of course, I will go to the highest. It's really very challenging, and especially with the rumors about the risk of the vaccine, the rumors about this, all unfounded. And therefore, ministries of health around the world, health agencies, they need to counteract these social media issues about the risk of the vaccine and the risk of doing this and the risk of... These are fantastic technologies. These vaccines are safe so far, and we need it to save life, to save our health services, and indeed to prevent very, very serious diseases. We need to look at the number of people, very high percentage of those who got COVID actually finished with what is called long COVID, long-term condition, i.e. they did not recover from the disease fully. They still feel tired, they still suffer, and just to click on the term long COVID, you will understand fully the complexity of this disease, and raising the immunity of the population is not only important, but it is absolutely vital. Let me touch in my final slide on the new variant, the H69 V70, sometime called B117. The English virus or variant was detected through actually whole genome sequences. These gene sequences is actually done in United Kingdom at an incredible level. I mean, so far, UK is #1 in gene sequencing of the virus. They've done more than 150,000 samples. The next one is United States, around 50,000, and then actually a European country, Denmark, with about 16,000. And it was discovered in September. By November, they discovered about 25% of the infected population. They have this new variant. By December, we know that the spread reached about 70% of those infected and those who are actually under treatment in hospital. So the transmission is really fast, and especially in those under 20. And we need to remember that this age group now, that's why we closed our school, we closed our universities. This age group actually is not covered by the vaccine. And we need to remember that. So whatever we do in the vaccine, even we cover the entire population, excluding pregnant mother and those under 20, we have to continue with our public health measures. And even more stringent, because those are the next generation of any country. So we must put on them a very high value and benefit of any doubt, but certainly the benefit of protection. And that message must go really very clear to everyone in the world, to all health authorities, to take that precaution which is needed. Even countries which is saying they don't have that level, you've seen the catastrophic things which has happened in Sweden. Even the king of Sweden appeared on television apologizing to the people about the wrong strategy which they adopted. They didn't lock town and cities. And today the parliament in Sweden, they gave authority against what is called civil freedom, because they have what is called in Sweden a unique country with civil responsibility. Our people are responsible to take action. They said we have to override that because the cases increased and our strategy was wrong. Same things with Germany. Germany was very proud with their approaches, actually reached a level now. Sweden and Germany have the highest number of cases per 1,000 population across Europe and the world. And of course, we're seeing the chaos in United States, thanks to Trump and his family, and the damage they did to the beautiful country of United States. Well, thank you very much indeed, and happy to answer any question.
Okay, thank you so much, Professor Salman. Now we have the open discussion. Anyone want to discuss further point with the speaker?
Dr. Salman, thank you for that. Yes.
Okay, Dr. Castro. Okay.
Yes, Dr. Salman, thank you for that excellent overview of the vaccinations. We here in the United States just got notification within the last hour that soon-to-be President Biden is going to order that instead of vaccinating people and then holding on to the supply that the United States has right now for the second dose of the Pfizer vaccine, that he's going to order to just vaccinate everybody. I'm assuming with the anticipation that we will be getting the second dosing in time. About a week ago, they were also contemplating, just as you mentioned, just dosing one dose. What are the consequences of the United States just taking all the supply, just vaccinating everybody, anticipating that it will be able to get the second dose for those people, especially when you nicely pointed out the logistics of the vaccine? Well, what do you think is the risk of doing something like that?
Well, thank you very much, Hector. This is superb questions. And of course, it was really thoroughly discussed in the UK. I did refer to our 4 chief medical officer, which is the highest medical authority in the country. And I agree fully with them that at the current status of the pandemic, with the huge number of people who are actually infected and in hospital, our hospitals in the state and Europe are overstretched, you know, and a single dose will create sufficient immunity. Let me go through this one. Although may not be supported by the published data, but certainly it is supported by the unpublished data. And both the licensing authority in United Kingdom referred to the unpublished data, and WHO recently, they did refer to the same issue. That a single dose of Pfizer, you know, will generate about 51% immediately of protection, both cellular and fluid protection. But that not immediate within a few days. But if you see within the body, the unpublished data showing that within 3-4 weeks, that may go up to 90%. You know, so the issues of second dose, although it is licensed under emergency use, you know, for 2 doses, but because of the magnitude of the challenge we are facing, as you said, 1 dose will do the same. If we look at Oxford AstraZeneca vaccine, actually a half dose generate immediately almost about 90%. You know, a full dose, a single full dose generate about 70%, you know. Compare that 70% with the flu vaccine, which I took, and indeed I have to take every year as a health worker, you know. It gives me an immunity between about 49 to 51%, you know. So if we are getting something over 50 that we can cover the population, we could easily delay the second dose for 3 months, even 4 months, until we actually cover the entire population at risk and those eligible for vaccine. And then we give them a second bite of the cherry, you know, by giving the second dose. That the logic dictate, and I'm very, very pleased that United States followed what happened in Britain despite the criticism earlier. And Fauci, and I written to him, I said, you are wrong. You know, look at your data. It's very difficult to say to that man he's wrong, but he was wrong on many times, you know, in the past.
Okay, thank you so much, Dr. Another question? Yes, Dr. Rafid, you are on mute. Okay, muted. Okay, okay, Dr. Rafid.
Yeah, Dr. Salman, thank you very much indeed for the excellent presentation. It was really useful, and I fully agree with you regarding. I mean, I'm seeing it now. I'm as frontline health worker and also medical director. I mean, I can see the difficulties with logistics regarding the Pfizer, and I fully agree with you. Like, if we give 1 dose to start with as many of the people, at least we can protect a big mass of the population waiting to do something, or the virus will change. By the way, I just had my Pfizer jab about an hour, 2 hours now.
All right.
Yeah, so I'm all right till now.
Congratulations.
Thank you. Yeah, I was offered one yesterday, and I was busy at work, so I finished late, so I couldn't catch it. Then they called me today to get one, which is I'm lucky to have it. Now, to I take it after 3 weeks or 12 weeks, they told me it will be after about 11 weeks from the where I get it, which I don't mind. I mean, as Dr. Salman said, I mean, I think hopefully I'll be protected during that time. If I'm lucky I get the second dose, I'll be even better. Yes, logistics is important thing, really. Dr. Salman, regarding for Iraq, I mean, what do you suggest? I know that Iraq government already they booked or they reserved a few millions, 15 millions, I think, or 20 million. I'm not sure of Pfizer. How easy is it going to work? I mean, we struggle with it. I mean, in the trust, where in our area, it was really struggle. Really, I mean, just imagine. I mean, you open the vial, you have to use it within 4 or 5 hours, and you have to call people sometimes on short notice to come because every vial you have to give about 190 doses. So, Dr. Salman, my question is that regarding Iraq, maybe an advice from you regarding what is best way to go forward. I mean, if they want to vaccinate the people in Iraq. Thank you.
Okay.
Thank you very much. It's a very good question. We shouldn't take it only for Iraq. You know, I mean, I can't give you.
I mean, the other countries. I mean,
yeah, I mean, I can't give you specific answer about Iraq because I'm on the committee, and yes, they did order about 1 million doses of Pfizer. But to be very honest with you, all middle and low income countries, and even some of the European countries, they will have great difficulty in handling Pfizer or Moderna vaccine. Moderna even slightly easier than Pfizer, but I strongly believe, and I'm sticking my neck out here and saying that once AstraZeneca is available around the world, that would be the vaccine of use. Also, the other vaccine, which is Johnson & Johnson vaccine, once that one approved, which could be used at room temperature and also used in a single dose, will actually spread around the world. And I don't think, COVAX, which is Gavi and WHO, who will secure about 20% of each country population around the world a vaccine once it become available to them. Pfizer didn't sign to them, but AstraZeneca did. And hopefully AstraZeneca will give these countries priority that we hope, and we are putting pressure now through our international networks for the vaccine to reach middle and low income countries by next month.
Okay, thank you, Professor Salman. Another question, Dr.
Okay, I have a question.
Okay, Dr. Yusuf.
Can
okay.
I?
Yeah, sorry. It's okay, go on. Okay.
That's all right.
Okay.
If you,
Okay, Dr.
I was going to ask.
Dr. Majid. Okay, how are you?
I'm fine. I have a bit of cold. I think. I hope it's not COVID. I'm waiting for my PCR.
Oh.
So I just want to ask Prof. Salman, Abu Ahmed, lovely for to listen to you again, and with a great presentation. Can I just ask you that I know we are the least involved when I say we are, because I'm a pediatrician dealing with children and pregnant ladies, mothers. So they are the least among the groups included in the vaccination, if you like, the lowest. But there are lots of ladies who are worried about this, not being immunized, especially either in their early pregnancy, and there's a long way to go, or those who have given birth and they are breastfeeding. I know we don't have much data about the effect and whether to immunize ladies who are breastfeeding, because we don't have much data. What are your views about immunization, immunizing women, whether they are pregnant or breastfeeding, please? Thanks.
I mean, so far it's contraindication. Thank you very much, Dr. Majid. And I wish you a speedy recovery from your cold. Hopefully it is a common cold. So far, the licensing authorities giving the temporary approval, emergency usage approval, EUA, and as well as the manufacturer, they put contraindication for children, adolescent, and pregnant mother, as well as lactating mother. So these groups are excluded.
Yeah.
Therefore, we need to be extremely careful, and let me stress a few points. All adults in contact with children should be vaccinated very quickly, especially,
Yeah.
for example, teacher, carer,
Teachers.
those people working in the kitchen, in the schools, bodyguard, whatever, anybody who will be in contact, bus drivers, etc., school bus drivers, anyone who actually will be in contact with our children should be vaccinated and considered as a priority group, irrespective of their age.
Yes.
Secondly, the supermarket. And let me stress the chaos, and today Worlds announced about that. The chaos in the supermarkets, is really need to be addressed as quickly as possible. They should limit the number. They should advise parents not to take children to the supermarket. The chaos of children in supermarket and exposing them to unnecessary risk. And you should lead on that, you in pediatrics. I'm in pediatrics too. But I think we should really push that agenda very carefully, that we have to protect our children for months to come. The vaccine is not suitable to them until there will be a vaccine which is tested in a clinical trial for children, pregnant women, etc. And most of the contact happening, unfortunately, as I said, in family gathering and supermarket. And again, my last point is about the family. If you have children, please protect them. Immunize yourself. Make sure that no stranger come in contact with them in your house, etc. Make sure that continuity in their education, not to be bored. I think we need to take extra measures, especially with this new variant, because in the first wave, these infections among young people were very, very low. That is not the case now, unfortunately.
Okay. Thank you, Professor Salman. Another question, Dr. Yusuf, Dr. Fadel.
Okay, hi everybody here. Sorry I'm late today to join this meeting, and thanks for Prof. Salman for this very informative talk, and congratulations for Dr. Rafit for his first shoot, and wishing just a common cold for Dr. Majid. Okay, my question is, in the worst scenario, if the COVID-19 hits the people and country very badly, and the only hope is vaccination, do you think a law from countries, especially American, European countries, will put a law for the vaccine to be obligatory for the persons? Do you think this will happen in the worst scenario? And and from rights of human beings, it is possible to do this?
Yeah, I mean, you are absolutely right with this beautiful question, but I doubt it very much. There will be compulsion. There will be compulsion through other routes. Already airline is talking about, I will not accept anyone who is not vaccinated. Okay, that's first compulsion. Gradually, people in public services where they have clients and contact will insist that their workers must be vaccinated unless there is contraindication, and health workers, for example, a lot of employers now insisting that healthcare workers, to protect them as well as protecting patients who are admitted to the wards, must take the vaccine. So there will be compulsion through other rules, but the government will say you must take it. I doubt it very much. By the way, France, for example, for all the children vaccination is mandatory, by the way. There are some European and Eastern Europe, Dr. Majid knows better than I do. It's mandatory, even children vaccination. So it's not unusual to have vaccine which is mandated by government. Even worse than that, in France, you will not get your child benefit unless you show a certificate of completion of vaccination, you know? So there are a lot of other ways of compulsion. Government and institution use it to make sure that you will receive the vaccine.
Okay, thank you, Professor Salman. Okay, before we closing the meeting, I want to ask you all a personal question, and anyone of you already vaccinated for COVID-19? Okay, the answer, no one vaccinated except Dr. Rafid. Okay, so the next question, if COVID-19 vaccines offered for you will take it, and why? If not, Dr. Salman, can you answer me?
I'll take it definitely. I mean, the day I'm on the list, not yet in this priority list, but once they call me, I'll take it. My son, who is orthopedic surgeon in training, actually, because he's working in frontline, he was given the vaccine. I will certainly take it. And it's not only that, I have a child 2 years old in my house. We are not allowing anyone to come to our house, you know. Not only that, it's we restricted now the trip to supermarkets, you know. And luckily we got a space here, so we are enjoying it internally. We need to be extremely careful about our children, to be honest with you.
Okay.
But certainly I will take it with pleasure.
Okay.
And I will be grateful. I will be grateful.
Okay, Dr. Salman. Dr. Castro. Dr. Castro.
Oh, no, yes, definitely. When it becomes available to me, I would most definitely take the vaccination, because I think that it's very important that everybody that can get vaccinated should get vaccinated in order to stem this pandemic.
Okay. Dr. Majid.
I will certainly take it unless I'm dead from this one. You know.
Okay. Dr. Fadel, what about you?
Okay, I exposed to COVID-19 several times, but I keep on strict prevention methods. So I believe in the prevention, and I will not take it.
Okay, thank you so much.
I will not take it.
Okay.
Okay.
Okay, we will meet you next webinar with the new trending subject. See you and stay safe, please. Thank you so much, and bye-bye.
Thank you, everybody.
Bye.
Goodbye now. Goodbye. Bye, everybody.
Thanks.